Who's ever heard someone say that they have SI joint pain or that their sacral nerve is bugging them, right? So I'm Amy with Moment of Truth Physical Therapy, pelvic health therapist, and today we're going to talk about the SI joint. What is it? Where is it? And why is it always being a pain in my butt? So it literally stands for sacroiliac. So your sacrum is the triangular piece at the bottom of the spine. You have cervical, thoracic, lumbar, sacral. It's that triangular piece down here at the very bottom of the sacrum is the tailbone. So then the iliac are the two pieces of the pelvis on either side, are crests on either side. And it can get very confusing because people say hip pain and they're talking about here, or hip pain and they're talking about their actual hip socket. So trying to clarify a little bit today, the SI joint is where the sacrum and the ilia meet. And there's literally a line, but it kind of fits like a puzzle piece. And so when things get shifted a little bit, that can cause irritation. Also, the nerve roots that come out from the spinal cord and come out and go down into our legs. The sacral plexus, anyway, we won't get into all that. But if you've ever heard somebody say, I have sciatica, the sciatic nerve is one of the things that gets blamed for a lot, but it comes out from here, goes underneath our glutes, specifically the piriformis, and down into the whole leg. So there's a lot of areas for things to get pinched or tight or shift a bit. And so we want to try to be careful not to say, oh, my back went out, right? Or my sacrum's out again. On one hand, that can be kind of accurate because the joint space can shift a bit. On the other hand, it tends to imply that at any given moment you might fall apart or become paralyzed. And the sacral pain can do that. It's a very unnerving situation when you get that kind of pain because there is a component of it that feels like the next wrong step, you might have your leg buckle out from under you, or your brain kind of goes DEFCON 5 with it and you feel like the next wrong move or shift and you might be paralyzed. And I honestly don't know why our brain sends such severe messages around this area. Yes, it's important. It's kind of the pivot point of the whole body, but it really is often just a mild asymmetry and a little bit of manual therapy, a little bit of joint correction, a little bit of addressing patterns, and you can be pain-free. In the next video, we're going to talk a little bit more about how this impacts women throughout their cycles and also during pregnancy.